So
All right, sounds good. Hello everyone. We are MSJ MedCore, and today we're going to be talking about unique medical careers. So, yeah, next slide. So, our first unique medical career is diagnostic medical sonography. These scientists use sonography or sound waves to generate images. They're known as sonograms to describe medical conditions. These are common in, for example, pregnancy, but they can also be found in diseases related to the heart, blood vessels, breasts, etc. In order to get certification in diagnostic medical sonography, usually requires a bachelor's or associate's degree, and then you have to pass a certification exam, and that usually takes around 2 to 4 years. And then the average salary is around 70K. Our next unique career is cardiac perfusionist. They essentially assist surgeons with open heart surgery. On the right, you can see a cardiopulmonary bypass machine, and these perfusionists essentially operate this machine, which pumps the patient's blood while the heart is stopped. The salary is around 70 to 90K, and like the previous career, it requires a bachelor's degree and a completion of training to be certified.
So, respiratory therapists help patients who suffer from chronic respiratory diseases like asthma, bronchitis, and emphysema, and they usually provide treatment to their patients. On a daily basis, they also analyze blood specimens to determine the blood levels of oxygen. So the average salary is around 62K, but obviously that varies based on your location. So I'm pretty sure it's a little bit higher in the state of California. It requires an associate's degree from an accredited respiratory therapy education program. So to obtain an associate's degree, it's usually 2 years, and you need certification from the National Board of Respiratory Care. However, it's recommended that you still get a bachelor's degree in order to like increase your odds of getting like a good job. So genetic counselors usually discuss like how susceptible certain individuals are to different diseases based on their genetic history. So they interpret lab results for genetic tests. They conduct research and present this on upcoming genomic studies. This job usually requires a master's degree in genetic counseling, and some even require a PhD. A lot of the people who are genetic counselors receive an undergraduate degree in public health, biology, or psychology, and they also require certification from the American Board of Genetic Counseling. And in order to obtain the certification, they must complete their bachelor's or master's degree first. The average salary is around 67K, but obviously this is dependent on which location that you live in. And I know that genetic counselors often work for hospitals as well as like private companies such as like 23andMe.
So next, I'll be going over the nurse practitioner and physician assistant occupations. So what is a nurse practitioner? A nurse practitioner is an advanced healthcare professional who provides primary and specialty healthcare. Like physicians, nurse practitioners assess and diagnose patients, order laboratory tests, prescribe medication, and manage health conditions. Nurse practitioners often work in a variety of specialty areas, including acute care, oncology, women's health, neonatal health, psychiatry, and mental health, as well as pediatric and child health. NPs also work in subspecialties like cardiovascular, hematology and oncology, neurology, sports medicine, and urology. So moving on to schooling. Before one can begin preparing to become a nurse practitioner, they must earn a Bachelor of Science in Nursing and be licensed to practice as a registered nurse, also known as an RN first. Then you must attend graduate school, earn a Master's of Science in Nursing, also known as an MSN, and earn certification from the American Academy of Nurse Practitioners, also known as the AANP, or other related organizations. Following that, you have to earn a PRN state licensure as a certified nurse practitioner, a CNP, and salaries typically range from $120,000 to $150,000. So moving on, what is a physician assistant? Physician assistants, also known as PAs, examine patients, prescribe medicine, and order diagnostic tests. In most cases, they work under the supervision of a physician or surgeon, but they can also work more independently in some states, rural areas, and inner city areas, and consulting with physicians only when they need help with cases. So for schooling, to become a PA, you must obtain a 4-year degree and a completion of a 27-month PA program that is accredited by the AAPA. And then you must take the Physician Assistant National Certifying Exam, and you must be state certified and renew the certification periodically. In addition, 1 year of clinical experience is required. An additional fun fact about PAs is that 6 to 7% PAs actually are changing specialties each year. Because PAs receive general medical and surgical education and are required to recertified regularly, they can actually often change specialties without needing any new certifications. And salaries for PAs typically range from 98,000 to 150,000.
So next we'll be talking about speech pathologists. So many of you might not have heard of this before, but speech pathologists treat disorders that have to do with talking, articulation, speech, fluency, and other things. They work with ENT surgeons and psychologists to come up with diagnostics and clinical solutions for problems. And interestingly enough, it's possible for them to get a bachelor's degree in linguistics and not anything really STEM related, or also psychology. They can also pursue their master's in speech pathology afterward, and they need accreditation from the Council on Academic Accreditation for American Speech Language Hearing Association certified programs. They also need a certification from ASHA, which stands for American Speech Language Hearing Association, and must complete clinical hours there in order to finish off their education and become a professional. They earn $73,000 average per year. Next is a nurse anesthetist. So as the name suggests, these are the nurses who assist anesthesiologists with giving anesthetics, which help with administering pain and numbing medication. Normally they will work right before an operation or during an operation itself. And they'll be part of the team of the doctors who work in the surgery room at that time. Nurse anesthetists normally pursue a bachelor's degree in nursing, and they have to qualify for a master's degree. And in order to do so, they have to pass an exam called the NCLEX-RN and pass this specifically for CRNAs. They earn an average of $104,740, which is a really good salary compared to some of these other jobs on the list. Third will be a medical dosimetrist. So medical dosimetrists work with the radiation oncology team, and they're typically working with cancer patients and treat patients using radiation therapy, which is, they document treatment plans, talk with patients to come up with effective ways to administer the therapy, and also use computers, especially to come up with radiation treatments. They need 5 to 6 years of education, and this includes a 4-year college degree, specifically in physical sciences. And they also have to apply to a medical dosimetry JR Cert accredited program, which are very competitive. Like all of the other jobs on this list, they also need a certification. And for medical dosimetrists, this comes from the MDCB, and they have to earn a certified medical dosimetrist certification. They earn between $96,000 and $123,000 on average.
And our final unique medical career is pharmacologist. This is a really versatile career field. Pharmacologists are essentially scientists who develop drugs and test them on humans and animals. Something important to note is that pharmacologists are not pharmacists. Pharmacologists develop the drugs. They're not allowed to prescribe medication to patients, and they don't actually interact with them. Pharmacologists can enter both the industry. There are many companies such as Bayer, Pfizer, or they can go into research. And some jobs require only a master's or a bachelor's, but most of them require PhDs in a life science such as biology. To become a pharmacologist, it usually takes 6 to 8 years, and the average salary in America is 136,000. Yet, that, like Shriyansh said, that definitely depends on location. So here in California, it can go up to around 200,000 or more.
So we have a Kahoot for you guys. Before we get into that, I just want to quickly clarify that our presentation's goal today was to inform you guys about various jobs in the medical field that don't necessarily involve what we traditionally think of doctors. So it's really important to consider these as well if you are considering going into this field. And so now we'll get started with the Kahoot.
We can get started.
Cool.
Yeah, so I think everyone got this one right. So the main purpose of the immune system is to destroy invading germs in your body and to fight off sickness. So, yeah, so once again, I guess this one was pretty easy. So the antigens do trigger the immune system. So pretty much they react against the cells that carry them. And some of the further questions will explain this more in depth. Yeah, so this one was a bit harder. So the body pretty much has a generalized group of phagocytic cells that can attack microbes that have made it past the skin. So pretty much macrophages and neutrophils, which are two of the options, are the first cells to respond to an infection, and the monocytes will later migrate from the bloodstream into the body tissues and pretty much fight them as well. So to cells are actually a part of the acquired immune system and are only present after a specific pathogen has entered the body for a second time. Yeah, so most people got this right. Just for a general definition, innate immunity is a generalized form of protection against pathogens in the body. So pretty much the cells of innate immunity are just generally attack all types of invasive agents and do not interact with like antibody production, which all of these do. They're all very general except for plasma cells, which are differentiated B lymphocytes, which they pretty much release antibodies into the bloodstreams that are specific for a given pathogen. So as a result, plasma cells are only present following a specific infection, and they're a very crucial part of the adaptive immune response, but are not actually involved in innate immunity. Yeah, so this is actually building off the last question. So innate defenses, meaning something that's general, are the primary defense against diseases, but adaptive immunity is related to exposure to a specific disease. So pretty much what this means is that while some antibodies may remain in the blood after initial exposure, the small amount does provide sufficient immunity. That means these specific lymphocytes that produce antibodies during a second exposure are called memory B cells. And when an antigen is presented to a memory B cell, this produces the appropriate antibody and the cell divides and differentiates into these plasma cells, which we talked about in the last question, which are responsible for producing large amounts of antibodies against the specific antigen. So pretty much it is these specific memory B cells that quickly produce the correct antibody to help fight the pathogen for the second time. Yeah, so technically, so upon release, histamine will actually increase the blood flow to the infected area. And mast cells are also just another immune cell that is involved in histamine release, but they're generally like localized to various regions of the body rather than found in circulation. So pretty much basophils are the least common leukocyte found in the body, but they play a really key role in inflammatory response since they release the histamine and increase the blood flow. Yeah, so this is building off the last question. Mast cells are rich in histamine and other like mediators, so that promotes inflammation and other allergy symptoms in response to an antigen exposure. Yeah, so a lot of people got this one correct. It is the proliferation of cancer cells into new tissues, and these cancer cells take residence in other seemingly unrelated parts of the body, which allow it to spread. And that's why it's really important to get treated before this occurs. So pretty much antibodies, or they're also known as immunoglobulins, are produced by the B leukocytes and plasma cells, and they're a really key part of humoral immunity, which means having to do with bodily fluids. So as such, they can be found in several of the fluids circulating or exiting the body, meaning that it's not only blood plasma, but also tissue fluid, and they're also present on the surface of some immune cells. Yeah, so everyone got this one right. They can't be like an enzyme since they don't catalyze chemical reactions. So whenever a foreign pathogen enters the body, they pretty much use them and these uh, these like parts of their protein, and they use like T cells and B cells to help synthesize an antibody against the particular antigen. So yeah, at the end of the day, they are defined as proteins. Yeah, so this one's building off one of the unique medical careers we presented today. The average salary of a medical dosimetrist is 96,000 to 123,000, but it varies by location as always. Yeah, so everyone got this one right. So pretty much a cardiac phlebotomist is they assist surgeons with open heart surgery. So they do require a bachelor's degree since that is very dangerous at the end of the day. So yeah.
Okay.
Yeah, so congrats to everyone that placed.
All right. That's all we have for you guys today. Thank you so much for coming to our meeting about unique medical careers, and we hope to see you next time.
Thank you.